And here we are at Park Avenue LASEK, New York's only 100% non-invasive laser vision center. And today we're here with Dr. Chynn, Rhett the borzoi, who looks very sleepy, but he's fine. He's a therapy dog. He likes to be chilled. And one of our favorite patients, Gina, also. So, Gina is graduating from our care today, and Gina actually had LASIK done by another surgeon and had a minor complication, so Dr. Chynn took on her case. Dr. Chynn, can you just give me a little bit of background on the minor complication that Gina had?
Well, she had some scarring, and the other surgeon's a good surgeon, but, you know, the average person doing laser vision correction might do 10 to 20 or maybe 30 cases a year. A high level would be like 100. I'm doing about 1,000, so this is kind of our bread and butter. So a lot of times when patients have problems, you know, from surgeons who don't have as much experience, they refer them to us and we help them out, and that's the situation here.
Okay, excellent. And then would it be fair to say that, so you said there was like a minor scar or something like that?
Well, minor for us, but not so minor for the patient.
Of
right?
course.
What was it like for you?
It was fuzzy, and there was something in my eye, and it was literally in my frame of vision at all times. So especially, you know, when you're trying to focus, it was like you could split like what you're seeing. So because there was something like right in the middle of your peripheral vision.
Okay.
Yeah, she had a scar pretty much in the center of the cornea. So.
And how did you treat it? And how was it possible to treat it? When did you notice it? Like a couple of months?
Soon, right? It was like pretty soon after.
It was immediately after the surgery. I came here.
Yeah, sometimes if they have delayed healing of scars. So first we did steroid pills, we did steroid drops. Eventually we did something which is quite advanced, probably one of the only centers in the New York tri-state area, and that's using mitomycin C, which is it's from cancer chemotherapy. I don't know if we told you this, but yeah, it's a cancer chemotherapy agent that we use specially and we formulated specially, and that did the trick, and we got rid of her scar. Now what's your vision?
As of today, my vision is 20/15.
That's unbelievable. So that's officially better than 2020. So what can you do now that you couldn't do before?
I can get out of bed and see what's happening in front of me. I can swim, I can bike, I can do all kinds of sports that I wasn't able to do because of fear of getting water or something in my eye because of contacts and things like that. So now I am free to actually enjoy my life and do all the activities that I wasn't able to do before.
That's superb. That's we're all delighted for you. And one thing that's
you were like -5. So you want to explain to the audience what you could see and not see before you had your procedure?
So prior to having my procedure, I was -5, as the doctor mentioned, and basically everything was really fuzzy.
And then they undercorrected you too.
Yes, it was undercorrected because my official prescription was -4.25 and -5, and the process was we didn't want to, you know, make it too harsh to keep me consistent. So before I was able to see fuzzy faces at best. And everything was very blurry and fuzzy, and I was only able to see things very close in front of my face. Now when I wake up, everything is as clear as it could be. It's kind of like being in HD.
That's a superb way to say it.
We do have an HD option. We had that.
I got upgraded to the HD option.
Oh yeah. Yeah, that's right.
Yes.
And then one other thing that I think would be ring home for a lot of people out there. So people are petrified of the complications. Would it be a fair assessment to say that, heaven forbid, even if there is a complication, it's much easier to treat with a LASIK as opposed to a LASIK? Would that be a fair statement to make, Dr. Chynn?
Well, yeah, because sometimes on the LASIK, when I was doing LASIK, you get scarring under the flap, and then it's much harder to treat. Topically, because the drops don't penetrate the cornea that well, and then you sometimes have to lift up the flap and do more surgery. So it's easier to treat. And I think the main thing is if you go to a really, really good surgeon who has a lot of experience, I've done almost, 25,000 procedures now.
Oh, wow.
So there's almost nothing I really haven't seen before. So if the patient's very loyal and smart and compliant and you stick with the program, it's perfect. You know, we really wanted to also thank you. You are one of our favorite patients, by the way.
Thank you.
And one last thing, I know that there's 90% less complications with LASIK versus LASIK. Would it be fair to say the severity of those complications is less as well?
Well, yes. In other words, we're the only all-glass operating room because we're not cutting flaps. You can't, if she gets poked in the eye, her flap can't come up and stuff like that. I think, you know, the main take-home point is that the non-cutting procedure is safer than the cutting procedure. You just have to be more patient and take a weekend off and recover with your eyes closed, and the final outcome is better too.
I also think for a patient, it makes it a lot less scary.
Then you know that you're not having your eye cut.
Right, because, you know, it's just the idea of having your eye cut It's just terrifying, and it wasn't something I was willing to do before until this new procedure became available, which is why I was willing to try this versus there was no way I was going to have my eye cut. It was just too terrifying, so I kept putting it off because I was hoping something better would come along, which it finally did, which is why I was able to do the surgery now.
You know, we talked about this before because you were born in Kiev.
Yeah.
Last year I brought Rhett to Kiev because we raised money for a dog shelter and I wanted him to see his homeland. So he was in Kiev last year.
Oh, that's so amazing.
Yeah, and
that's
then I
really
might go
cool.
back to Ukraine later this year, and Dr. W just got back, so maybe at some point we'll get together in Ukraine because you haven't been there for 20 years or something.
Yeah, about 26 years, 28 years. Yeah.
It's changed a lot. It'll be fun.
Yeah. Sounds
So
good.
thank you very much, Gina, and anyone out there who doesn't want their eyes sliced and diced, give me a call at 212-741-8628. Alternatively, shoot me an email at info@parkavenuelasek.com. That's Park as in Park, Avenue as in Avenue spelled out, then LASEK, because we're doing the non-invasive technique. Also follow Dr. Chynn on Twitter, Facebook. If you're watching this, you're already following him on Facebook, but the Instagram is @EmilChynn, and the Twitter's @EmilChynn, also EmilChynn. So again, thank you very much, Gina, and thank you, Dr. Chynn. Pearls of wisdom as always. So yes, congratulations on your vision, Gina, and we'll miss you, but...
Well, she's going to come to Rhett's birthday.
Oh, okay, sorry. Alright, forget about that
Plus,
last
I need to
bit.
come for a checkup anyways.
And you can tell Rhett's Instagram.
So Rhett, the dog, the mascot, the one and only, his Instagram is @RhettBorzoi, so RhettBorzoi, and there's a little bit of competition going on between the boss and the dog, so I'm in charge of the boss's account, Dr. Dobchuk's in charge of the dog's account, so like @EmilChynn first, and then @RhettBorzoi secondly.
Thanks a lot.
Thanks, you won't be disappointed.